I'm John Strum, and this is Real Talk MS. It's December 22nd, and welcome to the holiday week edition of Real Talk MS. Whether you happen to observe Christmas, Hanukkah, Kwanzaa, the winter solstice, or like so many of us, you're just really ready to say goodbye and good riddance to the year 2020, I want to send along my very best wishes for peace, health, and happiness to you and your loved ones. I think it's safe to say that this year the biggest gift of the holiday season has been the arrival of not one but two COVID-19 vaccines. To say that these vaccines are game changers might be the understatement of the year. Still, while the COVID-19 vaccines have created a tremendous amount of hope, they've also created an almost equal number of questions among people who are living with MS. So the National MS Society has convened a group of experts to provide guidance for people living with MS when it comes to making decisions about the safety, efficacy, and the timing of COVID-19 vaccines as they relate to certain MS disease-modifying therapies. Joining me today is Dr. Nancy Sicotte, and as the chair of the Society's National Medical Advisory Committee, Dr. Sicotte is leading the effort to create this very important guidance. Dr. Sicotte is a professor and chair of the Department of Neurology at Cedars-Sinai Medical Center in Los Angeles, where she's also the director of the Multiple Sclerosis and Neuroimmunology program. And Dr. Sicotte is here to answer some of the questions that are on most of our minds about the COVID-19 vaccines and multiple sclerosis. But before we get to my conversation with Dr. Nancy Sicotte, there are a few other things that you should know about. Those of you who are using Ocrevus to manage your MS have received a holiday gift from the FDA. This past week, the FDA approved a shorter 2-hour infusion time for Ocrevus. Now, the FDA based their decision to shorten the infusion time from 3.5 hours to 2 hours on data from a randomized, double-blind study that showed that once the first dose of Ocrevus was administered per the approved dosing schedule of 2 infusions given 2 weeks apart, there wasn't a real difference in patient outcomes between those study participants who received their second or later Ocrevus infusions over 3.5 hours and those study participants who received their second or later Ocrevus infusions over a 2-hour time period. As this shortened infusion time was approved for countries in the European Union just a few months ago, Ocrevus infusions should be a bit more convenient for the more than 170,000 people living with MS who rely on Ocrevus as their disease-modifying therapy. And if you'd like to review the details of the clinical trial that served as the basis for this approval, you'll find a link in today's show notes. Studies have found that somewhere between 55 and 80% of the people living with secondary progressive MS experience some form of cognitive impairment. And while cognitive dysfunction isn't a physical disability, its effects can be significant, and they can even be frightening. But an extension of the clinical trial for siponimod, commercially marketed as Mayzent, has shown that study participants with secondary progressive MS who took siponimod for 1 to 2 years showed improvement in their cognitive processing speed compared to those participants who didn't take the drug. Now, cognitive processing speed refers to the amount of time it takes someone to take in information, process it, and then react to solve a problem or complete a task. It's directly related to several aspects of daily life, including job performance, driving skills, and social activities. We know that MS is a progressive disease, so any sort of intervention that produces an improvement is worth noting. However, there were some limitations to this particular study, as the investigators did not measure or take into account the study participants' level of education or whether they were experiencing depression, and both of these factors have been shown to influence cognition. So we should welcome this encouraging news about a potential additional benefit of Mayzent, and we should also look forward to additional research being focused on better understanding and expanding upon these research results. Now, if you'd like to review the details of this study, you'll find a link in today's show notes. Investigators at sites across the United States are recruiting a total of 2,280 people who've been diagnosed with either secondary progressive or primary progressive MS to participate in two separate clinical trials for a drug called tolebrutinib, a potential oral disease-modifying therapy for progressive MS. One of the clinical trials will focus on people with secondary progressive MS, and the other clinical trial will focus on participants who are living with primary progressive MS. The primary outcome of both studies will be determining how treatment with tolebrutinib affects the time it takes for disability to progress as measured using the EDSS scale. Secondary outcomes of both trials include walking speed, cognitive function, disease activity on MRI scans, and quality of life. The study will involve up to 16 visits to one of the study sites over a period of between 2 and 4 years. These visits will include MRI scans, blood draws, clinical exams, and completing questionnaires. The sites in the United States include Boca Raton, Florida, Columbus, Ohio, Cordova, Tennessee, Fort Collins, Colorado, Franklin, Tennessee, Greer, South Carolina, Honolulu, Hawaii, Long Beach, California, Maitland, Florida, Naples, Florida, Northbrook, Illinois, Raleigh, North Carolina, San Antonio, Texas, Savannah, Georgia, Spokane, Washington, Springfield, Illinois, Tampa, Florida, Torrance, California, and Westerville, Ohio. To learn more about this study and find out if you're eligible to participate, you can call 800-733-1610 and choose extension option 6. Or you can email us@sanofi.com, and I'll include that phone number and email address in today's show notes. And when you're living with progressive MS, it sometimes seems easy to let others step up and participate in a clinical trial. Well, I don't think I have to remind anyone living with progressive MS of the limited number of disease-modifying therapies that are currently available to them. The way that number increases is through clinical trials. Otherwise, important MS research comes to a standstill. So I hope you'll take at least the very next step and get more information about this clinical trial. You could play a role in making the next breakthrough in MS treatment a reality. And speaking of breakthroughs, it's difficult to imagine a bigger scientific breakthrough in our lifetime than the two highly effective vaccines for COVID-19 that are already being distributed. And along with those vaccines come a lot of questions about how those vaccines are going to affect people living with MS, people who may be on disease-modifying therapies. In a moment, we'll get to some of those questions with my guest, Dr. Nancy Sicotte. The National MS Society has convened a group of experts to provide guidance for people living with MS when it comes to making decisions about the safety, efficacy, and the timing of COVID-19 vaccines as they relate to certain MS disease-modifying therapies. Dr. Nancy Sicotte is the chair of the Society's National Medical Advisory Committee, and she's leading this effort. Dr. Sicotte is a professor and chair of the Department of Neurology at Cedars-Sinai Medical Center in Los Angeles, and she's also the director of the Multiple Sclerosis and Neuroimmunology program at Cedars-Sinai. Welcome to the podcast, Dr. Sicotte.
Thank you, John. It's a pleasure to be here.
The approval of two COVID-19 vaccines has created a tremendous amount of hope and an almost equal number of questions among people who are living with MS. It's worth mentioning that it's a common practice to exclude people who are immunocompromised or who are taking immune-modifying drugs from phase 3 clinical trials for any vaccine. And in fact, the clinical trials for the approved COVID-19 vaccines excluded people with MS. So can you tell us what sorts of questions your task force is working to answer in constructing this patient guidance?
Thank you, John. Yeah, as you've mentioned, we are tasked with providing expert updated information for individuals living with MS as the vaccines roll out and become available for general use. And I think we do this in the backdrop of a very contentious time in the medical profession and in our country regarding the safety and reliability of medical opinions, and as well as the whole safety around vaccinations. So it's very challenging. And I think, as you mentioned, because MS patients are specifically excluded from the testing, we are limited in our ability to provide completely, bulletproof data to support our recommendations. But that said, we do have a lot of information already about vaccines and how MS patients respond. And we have lots of information about these vaccines in particular from the clinical trials that have been completed. And so I would say, as a top line overview, what we feel so far is that these vaccines appear to be very safe. They are incredibly effective. And when we do the risk-benefit analysis, we think for the vast majority of our patients that getting the vaccine will be the right thing to do.
And when do you anticipate that the task force guidance will be available?
So we are working very hard to get our first draft of recommendations out by the beginning of next year, so within the next week or two. As you know, this is a rapidly evolving field, and we, by the time our listeners hear this, we should have 2 vaccines now with emergency use authorization from the FDA. So we want to be sure that people understand that this is a living document that we're creating, and that we are going to continue to add more information as it becomes available. And we anticipate that this will be a lot of changes and a lot of modifications as new vaccines roll out, as we get more experience with the risks and benefits of the vaccines. We will be continuously updating that information. So I want to just let your listeners know that they should continue to refer to the information that is provided and know that it will be updated as we go.
That's something we're going to be talking about, of course, as more information becomes available, as this guidance is released. You can count on hearing more about it. As soon as vaccines became the topic of conversation, I've probably received well over 100 emails asking the exact same questions. When will people living with MS be prioritized to get that vaccine? So what do we know about that prioritization process?
Yeah, so people should know that as the vaccines were coming to be reviewed, and there was a notion that they would be safe and effective and would be approved for emergency use, there was a process that was done to think about this carefully. And the National MS Society had a seat at that table and elicited input from other stakeholders in that process. And so the conclusions were that there would be a tiered approach to making these vaccines available, and really thinking about starting at the most affected individuals to begin with, and allowing healthcare providers to have first access, I think makes a lot of sense. And as we mentioned before, it's like when you put the oxygen mask on in an emergency on an airplane, you want to be able to help other people. And the only way that you can feel confident to be able to help other people is if you're protected. And this allows the healthcare workforce to be there for patients. So that includes nurses, frontline workers, people who are in the emergency rooms, in our intensive care units. They've been prioritized first. The second group is the group that's had the highest mortality during the pandemic. And those are individuals elderly people living in group homes, such as nursing homes or long-term care facilities. And that's because these are the people who have been devastated by the virus. And the feeling was this was a way to prevent further tragedies from occurring. And then next in the list will be people who are at high risk, who have other comorbidities. And MS is in that group. So MS is considered a condition that increases individuals' risk more so than an otherwise healthy young person without comorbidities. So I guess the way I think about our MS patients is they're not at the front of the line, but they're not at the back of the line either. And depending on their other situations, they may have even earlier access than otherwise would be the case based on those other factors we discussed.
Is the COVID-19 vaccine going to be like a regular flu shot that people will need to get each year?
So my goodness, I hope not, because of the logistics involved in something like that. Based on all the information that we've seen and from talking to our immunology experts, the immune response to at least these first two vaccines, the two mRNA vaccines with 95% vaccine effectiveness, are very robust. And there's also two shots, as you know. You get one shot, and then 3 to 4 weeks later, you'll get the second shot. And that really kind of revs up that immune response in a way that we think it should be durable. But the truth is, without having the long-term information, we don't know for sure. So that's definitely something that will be investigated. I'm very hopeful, though, that we won't need it at least for in a year from now, maybe 5 years a booster, but that remains to be seen.
This next question is not a question specifically about the vaccine, but it's a question that I seem to be receiving frequently now. A lot of listeners wondering about. In previous podcast episodes, we've shared that the data from the various MS COVID-19 patient registries suggests that by and large, people with MS who do contract COVID-19 seem to have about the same experience as people who don't have MS. Those that have a tougher disease course seem to have that due to their comorbidities. And it's been reassuring to see that MS doesn't seem to have a major impact on COVID-19. The question is, do we know yet whether COVID-19 has an impact on MS by affecting relapse rates, disease progression, or some other aspect of the disease course?
Yeah, that's a very important and timely question. What we know so far, at least, based on these registries, as you've mentioned, which have been incredibly useful, and I just want to call out the International Women in MS Consortium, who organized weekly calls and continues to do so to bring us all together across the world to share information. It's been incredibly powerful and helpful. And within just a few months, we were able to stand up these registries, including the COVID-MS registry that Ann Cross is leading at WashU, and also supported by the consortium and the MS Society. This is really helpful for us to be able to gather, new data. This is a brand new virus. We don't have any prior experience with this. But the good news is, at least in the short term, as you mentioned, the risks associated with COVID infection seem to track with the other comorbidities that we know about. So hypertension, diabetes, obesity, more advanced age, rather than having MS per se. And I haven't seen any data indicating that there's an increased risk of relapse associated with the infection. So that's also reassuring, because it's certainly complicated to be dealing with both the pulmonary infection as well as having a relapse. So we really haven't seen much of that. The longer term consequences are a very challenging and I think important question. We know that there are some people who are what they're calling long haulers, people who seem to have a really hard time kicking the virus and have symptoms for weeks and even months afterward. And it's not clear yet if this is something that we should worry about, particularly in our MS patients, or if this is just a certain percentage of the population that's going to have this unfortunate outcome. And so I think that's important information that we have to continue to collect data on to follow our individual patients who have contracted COVID and have had varying states of recovery. I will say from my perspective, in my patient population, I've had several patients who have contracted COVID and thankfully, for the most part, have really recovered pretty much completely within a few weeks. But this is a concern about whether there will be longer term complications from the virus. And from what I've seen, that probably will be related to these vascular changes. So there's a hypercoagulable state associated with severe COVID, and it seems to cause tiny little blood clots throughout the body, including the brain and maybe the heart and other organs. And so I think we will see a lot of data emerging from this over the next year or so.
Well, thank you for that clarification and getting a little more back to the topic at hand. Last question, what should people living with MS do now while your task force is creating its guidance about the vaccines and their impact on MS?
Yeah, it's hard because we're getting lots of calls and lots of concerns. So I say the first thing would just be to sit tight and recognize that the vaccine decision that you'll have to make won't be coming this week or next week unless you happen to be an MS patient who's a frontline healthcare worker. And I do have a few patients like that, and we've been having conversations about their decision making. So I think to recognize that by the time anyone would even have the ability to get the vaccine, for the vast majority of our patients, we will have a lot more information. And so I would say sit tight. You can start talking with your healthcare provider, your neurologist. But in general, what we know we will be recommending is that people stay on their medications, continue to do the things they've been doing to stay safe and to stay socially isolated. And in particular, if they are about to get one of the infusion medications, not natalizumab, but rituximab or ocrelizumab, that they might want to have a conversation with their neurologist about the timing of that. And there may be some ways to organize your infusions with the potential to get the vaccine to optimize the response to the vaccine. And so that may be a conversation if you're on one of those infusion medications to start thinking about. Our best estimate is that most individuals like our MS patients will be able to have access to the vaccine in the early spring. So we're talking about maybe February, but probably March. So the good news about that may seem like a long time away, but the good news is we will have a lot of information that will be gathered from all the vaccinations that will happen between now and then. And I think we'll have a lot more confidence in and hopefully instilling a lot more confidence in patients that this is both safe and effective.
Well, Dr. Nancy Sicotte, thank you for all that you do every day to improve the lives of people affected by MS. Thank you for taking on the important work of providing this COVID-19 vaccine guidance for people living with MS. And thanks for talking with me today.
Thank you, John. It's really been my pleasure. And as we've talked about, this will be an ongoing, updating information kind of process. So I hope to be able to share with your listeners these updates as they become available in the future. So thanks again for all the work you do to give us more information and get the word out there to our community.
That's going to wrap up this episode of Real Talk MS. Real Talk MS is powered by the National MS Society. And you can share this episode of the podcast by letting your friends or family members know that all they have to do is point their web browser at realtalkms.com/173. You'll find that link in today's show notes, so you can easily copy and paste it right into an email or text. I don't think I have to tell anyone listening to this podcast that the COVID-19 pandemic has intensified and in some cases multiplied the challenges of living with MS. More than ever before, people living with MS need access to reliable information, support, and connection. We're witnessing that even during a pandemic, MS doesn't stop. and neither does the National MS Society. With vital funding from supporters like you, the National MS Society is continuing to meet the urgent and expanding needs of the MS community during these unprecedented times, while ensuring that the MS research community rebounds quickly from COVID-19 so that the progress and momentum toward finding a cure continues. And that's why I hope that as you're able, you'll make a donation to the Society's COVID-19 Response Fund. It couldn't be easier. Just text the word GIVE to 68686, and you'll get a link right to the MS Society's COVID-19 Response Fund webpage. I hope you'll consider contributing today because it's never been more important. I'm John Strum. Thanks for listening. Stay safe, and for those who are celebrating, have a Merry Christmas.